Welcome back to We Do the Heavy Lifting. I'm your host, Dr. Jenny Yentis, and today we do Bench-to-Bedside. And our expert today is Dr. Aaron Morton. Dr. Morton's an assistant professor at Texas A&M University, and he studies neuromuscular diseases and biomaterials. And he's currently serving as a director of soft tissue regeneration and applied biomaterials laboratory here at A&M. So, Dr. Morton, thanks so much for being here with us. And got to ask you, kind of an odd question, didn't know I was going to ask this, but what are third generation biomaterials?
Well, first, Jenna, thanks for having me. And second, third generation biomaterials, unlike first and second generation, they can elicit protein transcription, they can elicit actions in the body,
Okay.
and they can also change themselves for better incorporation into the body. Whereas first generation was a ghost material, something like a pacemaker. You don't want it to do anything that the body would notice. And then second generation would be coatings, things for orthopedic implants, so that it'll be readily accepted, but you don't want it to cause anything. Third generation can operate in some sense like a drug and also be readily incorporated by the body.
Okay, so if I'm understanding that right, so a first generation would be something that the body shouldn't detect. Second generation, the body accepts the material as its own. And third, it accepts the material and can direct a few things.
Exactly.
Okay. So how are those being used?
So in my case, we've been looking at these in the application of soft tissue regeneration.
Okay.
So these are hard materials that I'm working with that can completely dissolve. So it makes them suitable for implantation in soft tissues. And so we were first looking at these in muscle regeneration and helping with healing of skeletal muscles.
Okay, so like if I work out too much and I tear a muscle, then I could put these in and it would help my muscle heal faster.
That was the idea.
Okay.
And then in 2019, a group published a paper showing that the types of materials that we were using healed skeletal muscle in a way that skeletal muscle typically hadn't been able to be healed before.
Okay.
So as a postdoc scholar, I was slightly devastated because being first to publish is the thing.
Yeah, true.
So then I ended up on a treadmill at 3 a.m. because I couldn't sleep.
Don't we all at some point?
Right. And we had a couple mice that had muscle dystrophy.
Mm-hmm.
And that's a situation where the disease itself causes muscle injury.
Okay.
And so I decided, well, the next step, if it heals a healthy muscle that gets hurt, maybe it can help diseased muscle that's already hurt. And so I lobbied for us using this material in the context of these mice. And my professor at the time was gracious and let me do that. And in as little as 2 weeks, the muscle that we had used the material on was larger and healthier than the muscle that wasn't. So immediately I snapped pictures of this with my phone, texted it to everyone that I knew, and said, which muscle looks bigger, the one on the right or the left? And so this was my unbiased sample with an N of 1. And the treated one was larger, and that kicked off the whole thing for me.
That's crazy somehow. But like you get these stories about how people get led down these paths, and it's always so interesting. It's not the way in which they intended to go at the first. So it's really interesting. So you noticed that you had something unique and something that could be potentially helpful. Where'd you go next with it?
Well, my first thought was this will be such a neat story to publish. They were first to publish for the muscle healing, and I could be first to publish for the muscle disease. But upon interacting with the materials chemist that generated this, they immediately said, you don't want to do that. You want to first file an invention disclosure with the university. Now I embarked upon a brand new path that no one had ever trained me for before.
Okay, so an invention disclosure, what is that?
So it draws a line in the sand at your institution. When you work at an academic institution, then some of this work must be owned by the institution because they are opening the lab space in which you do your work. And so you can immediately say, we have this thing, it does this thing, and here are the parties involved. And so that draws a line in the sand at that university and essentially means I can talk freely amongst people at the institution and no one overhearing a conversation in my office can do anything, because that essentially holds a place for me in line at the institution. It doesn't cost any money, and something that happens quickly. I just need signatures, and that holds a place in line. And then you can't publish, because as soon as you publish anything on it prior to protecting it with something like a provisional or a full patent, then it's done.
Okay.
Because it's in the public domain, and the idea is that you can't protect something that's available to everyone already.
So it's sort of like this idea when people throw out this term like trade secret or proprietary knowledge or something like that. It's sort of this idea of protecting an idea and maybe some data that go with it until the university can get a legal piece in place to protect it.
Absolutely. They call it the secret sauce. You can't give away the secret sauce until then. And so this was an unknown path for me. I feel like even today I can see about a flashlight's distance down a dark hallway. But I'm a lot further along than I was then. And so once I filled out the invention disclosure, then the university tech transfer offices, they descend and doing exactly what they're supposed to do, and they take the investigator under their wing, so to speak, and say, here's what happens next. And so they'll eventually file a marketing analysis where they look at numbers and they look at what you've done, and they make sure they understand it and decide if there's a potential for this in the marketplace. Is there a market for it? Will this help people, and will they buy it and pay for it? And is it novel enough that this is something that hasn't been protected before?
Okay. And then what happens next? Do you go out and like write the patent and file it, or is it just they've done this market analysis, they decide it's worthwhile?
So once they do the analysis, they come back to you and they say there is something here. So now you need to generate at least the data of what would be a paper.
Okay.
And so it doesn't have to be as sufficiently powered as a paper from a statistics standpoint. It can be N's of 3 to 4.
Okay.
But it does need to be almost as complete as a paper.
Okay.
And so then I spend time collecting that data. And of course, we need funding for that. And so there's biomedical accelerators. So I got funded through a biomedical accelerator, and it also immediately enrolled me in the business school's biotech entrepreneurship classes. So I took a semester of classes, and those were actually paid for by the NIH. So they have what's called the Small Business Entrepreneur Education Development Program.
Okay.
So I was enrolled in that. And so that gave me education on this path from the bench to the bedside.
Okay. So you get enrolled in these classes. Do you start your own company then, or is it just to help you understand the process of what would happen with your invention later on?
So, Jenna, this brings up one of the most challenging parts of this whole process. Is the answer is yes, it helps you with education, knowing what you need to do next as far as this global path. But finding out how to take the education and put it into something actionable, that was the hardest part.
That's the wisdom.
So much of these classes say it takes 10 years and $90 million to get a drug to market, and therefore it'll never happen without investor support.
Okay.
You have opportunities to try to seek a licensing deal where the university has protected your technology and they give someone the option to use it. Or you have the option to do a startup.
Okay.
And so that could bring up the question, what would cause someone to do a startup versus a licensing deal? Well, I chatted with the director of the entire medical school at the time at University of Missouri, where I was, and they had a company and mentioned that sometimes companies will license the tech just to kill it. You know, that if they have a competing drug or something, remember that if it takes $90 million to get something to market, then you want to protect the investment or at least see the return. So sometimes they'll license the drug so that it won't get to the market. And I know that could sound bad, but there's a business move there. Or they won't license it at all because it has not been effectively de-risked. So the goal of the investigator who cares the most about it and the university who holds the potential patent is that they want to see it commercialized. And so you really just look at the options and decide if the technology hasn't been de-risked enough. And that means enough data has not been collected on it to get it over this might work to this works, then you really need to form a startup yourself, because no one's going to care about it like you will.
Yeah. What are other points of consideration? What are important things that led you to, because you ended up going the startup route, what were those considerations besides, somebody else might license it to kill it? Was there another driving force or something else that really sealed it for you, that was the path you wanted to go?
The primary one was just that no one was going to care more about it than I was. I was the one that was in the lab on snow days when the campus was closed, and it may sound kind of bad that there were times that I kind of wished the data wouldn't work out, because then I could stop. But I always had to come back to, in the event that I had a child that had muscle dystrophy, and someone was in a lab and had done something that showed potential, I would want them to go forward. So that's how I've acted. And I've tried to do what was best for the tech. And the tech transfer office had tried to seek potential licensing deals and had thrown some things out there, but there was nothing promising, nothing that was actually moving forward. So I was also advised by the Biomedical Accelerator that you have enough here to form a startup. And so then began the whole path of a scientist, not trained in business per se. I've had education for, what needs to happen to get to the marketplace, but not trained in business, to now navigate, how do I do this? How do I do the startup?
So I guess, what were important pieces, if you know of other people that have a technology that they think can go someplace as a faculty member or as a student on campus? Because in some cases, the institution still owns, what the student is working on. Not all cases, but in some. What are pieces of advice or things that you want them to consider?
So one of my goals is actually to develop a streamlined process that is very actionable for both faculty and students here at A&M, so that it's as easy to navigate this process as it is to put in a grant, something we do routinely.
Yeah, exactly.
And I understand you have a patent also, so
I do. And
congratulations, those are hard.
It was 7 years in the making, but hearing you speak about this, I'm thinking about my own experiences, and I hit that crossway of startup or licensing, and it was just, we had gone too far down we'd gone too far down one path before I realized there was a whole nother path.
Okay.
Yeah.
So the first thing I would say is an invention disclosure. It's easy, it's signatures, you just do that right away, and it immediately takes some of the legwork out, because tech transfer will do their market analysis and decide potential, and then they will tell you, here's the data that I need to see, so it directs your experiments. It's almost like putting in a grant and getting comments back.
Yes.
And it kind of guides your experiments. And so then you do the experiments, and if the data turn out, then they will file the provisional and then eventually the full patent. And you play a game at that point. Patent duration is 20 years. Provisional patent's a year. So the amount of money and time it takes to get something in the marketplace is also time that it's not in the marketplace. And every year that's not in the marketplace, that revenue's lost.
Yeah.
So I spent 3 years doing work in the dark, trying to maximize patent duration, so that whenever I finally said, we need to do something now, that I can't keep this silent anymore, I need to seek partnerships, I need to commercialize this, then we went for the provisional, which bought us another year. Then we filed the full.
I gotcha.
And that was the whole goal. Invention disclosure first, guided data collection. There's still something there. Then decide, how long can I go before this needs to be disclosed. Then when the patent has been filed, then partner. That in my view, that has been the best thing that I did, was seek a CEO that was already running a legitimate company that was very successful. And that CEO, then watching him, is all the education that I could ever want. Just seeing how he thinks and goes through things, and immediately we established an operating agreement, which gives a company structure, and it makes me the chief science officer and him the chief executive. So I do what I keep doing. I do the science. And it opened up funding sources for me, such as small business grants that I wouldn't have had access to before. But I'm not utilizing any of my time, really, in making this company go. So it's not conflicting with my university work, which is one of the biggest concerns when you think about that.
So I have two questions for you. One is, how do you progress as a faculty member or as a postdoc without publishing? My other one is, and I'm sure all of our guests are wondering, how in the world are you paying the CEO? So two very different questions, but I didn't want to forget the other one, so hopefully we'll remember them.
Sure. I'll remember. Those are very good questions. So number one, I have multiple lines of research.
Okay.
So I also have neurovascular crosstalk experiments. How do blood vessels and nerves talk to each other during regeneration? So I was able to work on that side. As far as the publication factor, during COVID is where I was kind of doing some of this. So there were some leniencies on the publication numbers that some people had. So that helped with a little bit of it. And people weren't going to conferences, and I didn't want to publish this at conferences. So that's part of the game, right? In the event that you go, I need a publication, you go to your tech transfer office and say, I need to get this out. They'll do a provisional. That'll give you a year. It's probably about $250, and it's worth it to them. And then you're protected to publish whatever is in that provisional over the course of the year. And their goal is not to hold you back. They just say, in the event that you can hold back, then do, because it maximizes patent duration.
Okay.
And then your second question was, how do you pay the CEO? So the way we did it is I recognized early on the operating agreement was the way I paid the CEO.
Okay.
So the operating agreement immediately gives market share to both parties legally. So we sat down and had a conversation. He can't do it without me because this is science. So he needs a science officer who understands it, and no one understands it better than me. I can't do it without a business professional, but 50-50 partnerships don't work because eventually there needs to be a decision made.
Yes.
So we have a 35-65 split on the major shares that have the majority voting rights. And so he's paid with 35% equity in the company. And that company will need to license the technology through MU, and I have their approval to do that. So he's paid with sweat equity first, and then small business grants at the moment for us seem to be the fastest path to write him in as a salary for a couple years, and that's kind of seed money.
I see. So then he's the one going out and looking for venture capitalists. He's the one trying to grow the money coming in while you just continue doing the science.
So we're sitting down and looking at regulatory strategy. You know, because there's potential in the wound healing space, then there's potential with veterinary medicine. Something like muscle disease is an orphan disease, so it's actually faster to get something to approve for a disease that affects fewer people than it is for something that affects widespread. And that's just to try to get therapies there. So one reason you target some of those is for that reason. So I can now be in multiple places at once. So there's the Muscle Dystrophy Association conference in Dallas, Texas in March. Well, in March is when I've scheduled my long-term time point studies for this material that's been going for 140 days. So I can't be there, but he can. And he has a friend who's had 30 years of sales experience. So both of them are excited to go. And I have connections that'll be there, and I'll give them connections. And it's the most relaxing thing in the world to know I can now be in two places at once.
That's kind of nice. You've cloned yourself in a way.
So before I had the CEO, then I kind of reached out to some entrepreneurship places on campus, and I essentially got added to a listserv that said, now join these webinars for commercialization. And I think that one of the things that we certainly need as a field is to have at least a matchmaking site that has where CEOs can get on, and then technologies that are in the intellectual property database of the university with the investigators that are active there are listed, and CEOs can kind of link, because when I mentioned to the CEO that I have, the challenges that I had faced in even finding one, well, he got excited going, you mean there's scientists and brilliant people throughout the halls of Texas A&M that don't know how to take that technology from where it is in development to the marketplace? And I said, exactly.
Yeah.
When you stand there excited on the side of the river, and the ferry to get across is a company, and you're not sure how to get there.
Yeah, I think that is probably one of the biggest fear is a lot of academics. We probably know as much about business as anybody else would. You're not a business person. You run a lab, so you kind of manage your own little business. You have budgets and things like that, but actually going out and trying to get something to move through regulatory, move through venture capitalists, move through all of these different, it's foreign. It's not something you're trained or taught.
Which is something I'd like to change.
Yeah.
I noticed that many of the very successful investigators that were at other institutions that I had trained at had intellectual property in the background. Mm-hmm. And I didn't learn about it until later it becomes successful and you see that they're affiliated with some company. So I would like to make sure that in order for my graduate students to be successful in the future, and I think in order for science to be able to compete in a sense with industry, mm-hmm. because there needs to be a place for science.
Yes.
That's separate from that industry. Science is separate from industry means we can drive a little bit of our own program. Mm-hmm. Industry drives the program of industry. So there's a little bit of flexibility there. Then there needs to be better options for scientists. And so there's been discouragement about postdocs just immediately heading straight to industry instead of thinking about academia. Yeah. But if I can say to a postdoc, you can come work with me and let's develop some intellectual property so that your highest aspirations are not in life are not to necessarily just work in academia for mm-hmm. this pay here or to work in industry for this pay here, but you can potentially own something and change lives and do well in that regard also.
Well, this has been really informative and interesting. So thank you so much, Dr. Morton. We always ask individuals, you have any last minute thoughts or anything else you want to throw out there to our audience? Take homes?
Getting something from the bench to the bedside is a long process and mm-hmm. and takes a long path. And so just some grace for the investigators that are trying to do that, a recognition that there will be money involved in it, and it has to be that way because someone has to pay the bill for all of that. And so in the event that there's some kind of concern about certain drugs getting to market, even COVID and mm-hmm. vaccines and the way those things got to market, and there's some speculation that maybe there was some money behind it, the answer is probably yes, and I would encourage you to seek out more information about the path from bench to bedside because it really does clear up a lot of how our drugs get to market. But we are thankful for the regulatory strategies that are there, mm-hmm. and those are the things that keep us safe.
Yeah, absolutely. Well, thank you so much, Dr. Morton, for joining us today, and thank you to all of our listeners for joining We Do the Heavy Lifting. As always, if you have a topic that you would like for us to cover, please email us at huffines@tamu.edu. And we're happy to take any other comments or questions as well. So till the next time.